etc. Okay.
Okay, sir.
And serologic test PCR, serologist PCR, then PCR and serologist test and chest X-rays. Then what about key research? What is? Can you read next column? What is that next column? Key symptoms.
Yes, sir.
Can you read out, please?
Fever, cough, difficulty
Correct.
breathing. Uh,
Perfect. Like that, you can read 10 papers.
okay. Fever, chills, muscle aches.
Ah,
Sir, one below the other, I should read.
yeah, please.
Oh,
Next by.
and then immunodeficiency, weight loss,
Ah,
jaundice, liver inflammation,
hmm,
fatigue, liver cirrhosis,
hmm.
high fever, severe joint pain,
Correct.
mild fever, rash,
Ah,
conjunctivitis,
ah,
um, hemorrhagic fever, organ failure,
ah,
rash fever, cough,
hmm.
severe respiratory illness.
Perfect, perfect, perfect. Next, next column.
Affected regions global wise, global,
Hmm,
sub
hmm.
Saharan
Global
Africa.
means entire the world.
Yeah,
Ramson,
yes,
yeah.
sir.
Next.
Sub-Saharan Africa, global.
Ah,
Global, high in Asia, global.
ah, ah.
Tropical and subtropical regions.
Yeah.
Tropical
So
and
in this
subtropical regions.
global, we have n number of viruses. So many viruses like COVID-19, influenza, HIV, hepatitis, so many viruses. Next.
West
Ah,
and Central Africa, global, Middle
ah,
East.
hmm,
And then current diagnostic challenges.
hmm,
Emergence of new variants affecting test accuracy,
hmm,
rapid mutation rates leading to
hmm.
vaccine mismatch,
Hmm.
social stigma hindering testing,
Correct.
need for early
Correct.
detection,
Correct.
asymptotic early stages, liver fibrosis assessment,
Correct.
high cost of antiviral therapy, identifying treatment respondents,
Hmm.
co-infection with other viruses, distinguishing severe cases,
Hmm.
asymptotic cases, complicating surveillance, pregnancy-related risk,
Hmm.
rapid transmission in outbreaks,
Hmm.
need for rapid diagnostic,
Hmm.
vaccine hesitancy leading to outbreaks, high
Hmm.
con contagion,
Hmm.
and then zoonotic transmission, complicating control, high
Hmm.
mortality.
Hmm.
The last column is,
Mortality means death rate.
yeah,
Hmm.
the last column is potential AI or deep learning solutions.
Hmm.
AI-driven genomic surveillance to detect mutations,
Perfect.
CNN for
Correct.
image analysis,
Correct.
AI models for predicting viral evolution, machine learning for vaccine design,
Hmm.
AI algorithms for early detection through pattern recognition in routine test,
Correct.
AI assisted imaging for liver fibrosis, predictive analysis
Hmm.
for disease progression,
Hmm.
machine learning models to predict treatment respondents, cost effective, AI
Hmm.
diagnostic, AI models for
Hmm.
differential diagnosis prediction analytics for outbreak
Hmm.
forecasting,
Perfect.
AI driven risk modeling for pregnant women, deep learning for symptom recognition,
Correct.
AI enhanced rapid diagnostic test, predictive
Hmm.
modeling for outbreak containment, AI for
Hmm.
monitoring vaccination coverage, predictive analytics for outbreak risk,
Correct.
AI model for detection in camels and
Early
humans
detection. Early detection in camels
and
and
humans,
humans.
deep learning for
Deep.
chest imaging.
So now what we are understanding this viral diseases and AI solutions, we have a number of viruses nowadays. We don't know what type of virus is coming. So we have a AI solution must be ready. As a engineers, we need to develop a model. So for that one, what we are doing, what is meant by viral diseases? It continues to pose significant global health challenges and necessitating advanced tools and techniques for prediction and detection of viral diseases on COVID-19, Zika virus, Ebola virus, etc. This research presents a robust AI framework that leverages deep learning techniques like CNN, RNN, LSTM, Keras, TensorFlow, etc., with integration, with leveraging, including generative adversarial networks, convolutional neural networks, recurrent neural networks for the prediction and detection of viral diseases through medical imagery. We are taking data sets like X-ray images, CT scan images, and text data. The framework integrates like hybrid model integrates generative adversarial network, Gen AI, transfer learning, convolutional neural networks, and recurrent neural network architectures with innovative data augmentation methods to improve model generalization and resilience. Then what about this research understands? We need for timely and accurate detection. That is our issue in global health. We are advocating for the use of deep learning and generative AI models equipped with robust and data privacy features. So, in clinical settings, the integration, the leverage of generative AI, explainable AI, generative adversarial networks called GANs, federated learning, and transfer learning enhances transparency for radiologists and transforms the role of artificial intelligence in viral disease detection. So our proposed integrated model called leveraging framework model demonstrate exceptional accuracy. We are comparing with existing system, sensitivity and specificity and surpassing current methods and addressing computational challenges for real-time deployment in any resource-limited healthcare environments. We are proposing five major methodologies for viral disease prediction and detection. The first one is COVID-19 and pneumonia severity detection and analysis we are finding with the combination of CNN and RNN techniques. Then second methodology is called generative AI for viral prediction. Here we are integrating with the generative AI model with the Keras and TensorFlow models. We are providing valuable insights for proactive planning. Then the third major methodology we are combining with the vision transformer, generative adversarial network in COVID-19, and computer tomography image synthesis. We are taking as a CT images for synthetic data for augmentation to improve accuracy and reliability of the both standard and non-standard medical scans. So the fourth methodology we are using explainable AI and transfer learning, transformers, deep learning for viral detection. We are combining with utilizing text data, chest CT scan, and X-ray scans. This approach employed explainable AI techniques to elucidate the decision-making process of deep learning models like CNN, RNN. We are integrating so that we are enhancing trust and providing radiologists with meaningful patterns associated with viral diseases. The last technique methodology we are using federated learning for viral disease detection. We are executing our program, our data set on different environment, their server, their system, and their data center. While addressing the data privacy concerns, a federated learning model enabled with the decentralized training on local data sets within a hospitals and clinic without sharing specific data, resulting in globally accurate and precise disease detection model. So finally, we are comparing with comprehensive five approaches of methodologies with existing drawbacks with existing models in the terms of text data, CT scan, and X-ray images. We will employ both convolutional neural network and recurrent neural network methods. It considering various parameters such as accuracy, precision, time complexity, and overall performance. These are the keywords I'm using for this research proposal. Deep learning, generative AI, COVID-19 detection, generative adversarial networks, pneumonia analysis, chest CT scan, generative adversarial networks, and explainable AI, CNN, RNN, federated learning. Then coming to introduction, we have a number of viral diseases in a globe are caused by infectious agents called viruses. You know virus expansion, Ramchand. I am asking simple question. What is meant by virus? Can you expand virus?
No, sir, sorry.
No problem. Virus. Can you spell it? VIRUS.
RUS.
Perfect. Now listen. V stands for vital information resource under seas. Virus is a program. Virus is a function. It replicates itself. It collapses all the files. Viruses examples like Trojan horses, threats, malware, spyware, criminal activity, anything can be a virus and can range from mild to common illness like the common cold to severe and potentially life-threatening conditions such as COVID-19, pneumonia, influenza, hepatitis B and C, etc. We are testing with the text data, chest X-ray image and CT scan images are diagnostic radiographs of the chest area that are commonly used to visualize and assess the condition of the lungs, heart, and surrounding structures. The global healthcare landscape has been significantly disrupted by the emergence of viral diseases, most prominently the COVID-19 pandemic. We have combining with artificial intelligence like transfer learning and generative AI models holds significant potential at the and intersection of healthcare and technology. We have tested with the text data, chest X-ray and CT scan images are crucial for diagnosing viral diseases, revealing insights into repository conditions and addressing challenges with convolutional and recurrent neural networks. That is called convolutional and recurrent neural networks. The research signifies a transformative shift in medical diagnostics, integrating advanced AI to revolutionizing the detection of viral diseases with a specific focus on challenges posed by viral diseases. The research introduces comprehensive approach, integrating with the deep learning like CNN, RNN, LSTM, Keras, TensorFlow, PyTorch, K, Scikit-learn, K. There are sklearn, generative AI models, providing an innovative framework for accurate, timely, and nuanced diagnostics and emerging global health threats explored through 5 cutting-edge AI methodologies we are using. Then coming to literature survey, we have collected 178 literature survey papers so far from 2020 to 25 from diverse journals including IEEE, Springer, Elsevier, MDPI, and preprints other journals. So this is about literature survey of IEEE journals, Springer journals, Elsevier journals, and MDPI journals and other journals and IEEE conferences and preprints. This is the literature survey we have done. Ramchan, I
Yes, sir.
have a question. What happened your paper? Have you submitted or do you want my help?
Actually, we have found out Journal of Journal of Engineering Education from
Perfect.
Wiley Publications from USA. So
Wiley.
yeah,
Wiley. You
yeah,
need to say Wiley publications.
yes, sir. Wiley Publications. So they
Ah,
are, we are just converting the format according to their requirement.
ah.
Maybe tomorrow we will submit, hopefully.
Perfect. How many members are there, Ramchand? Any doubt from them?
No, sir, everything is fine so far. We are, including you, there are six of us.
No, 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 no. If you want, you can include. Otherwise, no problem, Ramchand. I am not. It is not a mandatory for me.
No, sir, because you have
I'm
helped, no, at
I'm
least.
a friend. That's why I have worked on that paper. I have done evaluation metrics. Have you seen my
Yes.
contribution in that paper?
Yeah, very much, sir. I saw it was quite good. So I think you being inside the paper will be good. So I have added you.
Oh, okay, no problem. Is it a Scopus or SCI?
It's Q1, sir, SCA only.
Okay, let's see. Can you send me that journal name so that I can verify whether it is a cloned journal or I mean original one?
Sure, sir. I will send you, sir. I will send you that. Actually,
Okay. So this is the literature survey on AI-driven support for viral disease detection. There are 20 papers we have collected from 2000 to 2025. Like author details, limitations we have find like issues, challenges, existing method, proposed approach, data set utilized, techniques applied, tools, validation metrics they have used, future direction and references under your DI URL. So we have collected 20 papers of base papers of my this research proposal, and we have identified common drawbacks. In order to avoid the common drawbacks, we are using a hybrid model. We have collected 178 papers. Then we come across with top 10, I mean top 5 literature survey papers which are closely related to research proposal. According to J and Kai, they have developing deep LSTM with later temporal attention for predicting COVID-19 severity, clinical outcome, and antibody level by screening serological indicators over time. The paper came in the year 2024. The techniques they have used the long short-term memory technique with various parameters like severity, clinical outcomes, spike antibody levels. The data set they have taken time series data for serological indicators from COVID-19 patient to train and evaluate the deep LSTM models. What are the drawbacks they have identified? Limited generalizability, data dependency, complexity in implementation, etc. Anesthesia and his team, they have published the beautiful paper called Artificial Intelligence Mechanism, Machine Learning and Deep Learning Potential Resources for the Infection Clinician. So this paper came in the year 2023, and they have used the techniques like artificial intelligence, machine learning and deep learning, including generative AI. Data sets they have used computer tomography scan images. The drawbacks they have listed in that paper: limitations of COVID-19 detection, accuracy of machine and deep learning techniques, and RT-PCR based model with support vector machine, challenges in COVID-19 detection. Coming to Jashmadi and his team, they have published the paper called Artificial Intelligence and COVID-19 Deep Learning Approaches for Diagnosis and Treatment. In this paper, they have used generative adversarial networks and extreme learning missions, that is called ELM, and long short-term memory LSTM, data set, clinical data, and medical imaging. So these are the drawbacks we have identified in our base paper. Okay, so we are using limited validation and benchmarks, interdisciplinary gap, and you can call it as data privacy and ethics. Then generalizability and adaptability. Coming to next fourth paper, Rahman and his team, they have done a fantastic job on COVID-19 detection empowered with machine learning and deep learning techniques. A systematic review they have done. This paper came in the year 2021. They have applied a techniques called support vector machines and data set X-ray based. And here are some drawbacks we have identified: limited score, real world applicability, accuracy metrics, and data privacy. Then the last one, Jagby and his team, they have developed a fantastic application called deep learning techniques for detection and prediction of pandemic diseases like a systematic literature review. In this paper, they have used deep learning techniques, data sets they have used online scholarly repositories like Kaggle, GitHub, UCI, etc. There are some potential drawbacks they have identified called computational complexities, improper labeling, absence of high quality data sets, model performance. Then the sixth one, Giuffrecci and his team developed a beautiful paper called Deep Learning Based Detection of COVID 19 virus chest X ray images. So, this paper published in the Multimedia Tools, it is a SCA paper. The paper came in the year 2021. The techniques they have applied deep learning techniques, namely ResNet 50, Inception V3, and VGG 16, and a data set they have used chest X-ray images. There are some potential drawbacks or data augmentation limitations, generalization beyond binary classification, limited validation and external testing, ethical and privacy concerns, sensitivity and data set quality, clinical integration challenges. Then these are the drawbacks we have identified from 178 papers like data dependence, then model interpretability, overfitting and generalization, limited scope, real world applicability, accuracy metrics, data privacy and ethics, interdisciplinary gap, computational complexities, etc. So these are the major challenges we have identified 178 literature survey papers, data quality assurance, computational efficiency and resource optimization, interdisciplinary collaboration, ethical and privacy framework, and finally generalizability and adaptability. So the problem statement says that n number of viral diseases are there, and how do we can easily find out infectious disease, maybe viral diseases on different data sets like text data, computer tomography scans, image data, and X-ray data. So there are various traditional and existing techniques are available, and we are not getting that much accuracy. That's why this research includes a decision support system and leveraging with the deep learning, mission, and generative AI to enhance diagnostic accuracy. We are improving the generalizability of detection models and ensures reliability and real-time analysis. And we are taking with actionable insights for a better diagnostic purpose. Then we are using what is the heading of this, Ramchand? Are you there?
Yes, sir. Objectives.
Objectives of viral diseases. We are enhancing diagnostic accuracy. We are enhancing model disease progression. We are ensuring model interpretability. We are prioritizing data privacy in decentralized learning. Because you have a very less time, that's why I'm moving fast. So these are the knowledge gaps we have identified from 178 papers, like limited T cell response data in the elderly, inadequate predictive models for infectious diseases, privacy issues in centralized data storage, low accuracy and high false positive rate in COVID-19 detection, limited data set and availability in generalizability. Then coming to input data sets we have collected from free open source repositories called text data, chest X-ray images, CT scan images on Kaggle data, GitHub, and UCA repositories. I have collected it from GitHub 5,000 images, and from Kaggle I have collected 2,000 images. Okay, from a UCA repository, remaining images like 7,000 images I have collected, and text data also collected. Then we have tested with various techniques, data sets we have used X-ray, CT scan, MRI. Okay, magnetic resonance image, X-ray, CT scan, CT means computer tomography scans. Then we are using a genomic data. We are using medical imaging data like COVID-19 chest X-ray data set from Kaggle and the National Institute of Healthcare, RSNA. We are collecting the data, pneumonia, HMPV, that is the latest virus from China. We got it, HMPV, and dengue and hepatitis liver ultrasound data set, genomic and omics data set, and we have a number of data sets like a HIV-1 genome sequence data set, hepatitis C RNA sequences. We have a number of another data sets like from World Health Organization, CDC disease surveillance. So many repositories we are having, and we are detecting, predicting with the hybridization models like a federated learning, and we are using a convolutional neural networks, recurrent neural networks, generative AI, with the transfer learning on a health data sets, multiple data sets we are using, and multi-hospitals collaboration for real-world validation for federated learning we are using. Then you can see that this is a input data images data set. You can call it as a, it is a data set image. Okay, data set images for a chest X-ray images. So we have collected 5,000 images from GitHub. Okay, and we have remaining data sets like from Kaggle, we have collected pictures from heart, lungs, airways, blood vessels, and the bones of the chest and spine, commonly used for diagnosing conditions like pneumonia, heart failure, and lung cancer. Then what about we have input data set for COVID-19 patients, then input data images for a then we have various kinds of data sets. So this is the input data set. We are using patient ID, age, gender, COVID-19 status, X-ray type, and GAN synthesized data, federated learning set, privacy, compliance level, medical image data, diagnosis confidence score. Finally, we have a target class, whether it is a COVID-19 or not. So this is the synthetic data set we have created from GitHub and Kaggle and UCA repository. Then we are performing, what is the heading of this, Ramchand?
Proposed model, sir.
Yes, we have. See, out of 178, we have identified so many drawbacks. We are proposing three models like hybrid model with the data augmentation and regularization techniques, federated deep learning like CNN, RNN, LSTM with embedded interpretability and modules, and generative AI and transfer learning for viral disease detection. So these are the proposed models we are using, like explainable AI. This is extension of AI. We have a transfer learning, explainable AI, and deep learning like CNN, RNN, LSTM for viral disease detection, federated learning for viral disease detection. Then what are the model architecture? Architecture is a structure which comprises the hardware and software components and collections among them. We are combining with the deep learning models like CNN and vision transformers called VITS, recurrent neural networks like RNN, hybrid CNN RNN model we are using. Then generative AI models called generative adversarial network models for data augmentation. We are using a cycle GAN and a style GAN, generating synthetic medical images for data set expansion, and conditional generative adversarial networks, that is called C GANs, creating patient specific synthetic images. Finally, we are evaluation of Frechet inception distance and inception score, that is called IS, for GAN generated image quality. So these are the federated learning like decentralized learning with the multi-node setup. We have a client institution, server aggregation, privacy mechanisms, and differential privacy. Then explainable AI, we are combining with the sharp, shapely, additive, and explanation, feature importance analysis, and local interpretable model agnostic explanations, grade cam, gradient weighted class activation mapping. Then we have advantages with proposed techniques. We are enhancing model reliability, decentralized learning, transparent decision making, improved generalization and efficiency. This is the architecture for steps in developing models using AI algorithms. For AI decision support system, we have a raw data with inclusion of text data, image data, CT scan images, X-ray images. Then we are taking external raw data also. Then we are processing the data pre-processing. We are eliminating noisy data, inconsistent data, dirty data. Then we are collecting a server and data center from cloud environments. Then we are performing validation data set whether our model is correct or not. Then we are checking with external testing data set like training and validation. 80% of data we are taking as a training, 20% of testing. Then we are performing performance evaluations like accuracy, precision, loss, time complexity, F1 score, AUC, ROC, and confusion matrix we are using. Then we are evaluating training model. Finally, it will display the model evaluation. Whether our model is correct or not, we are justifying. Finally, our model is evaluated with 97.7 percentage. This is the reference I have taken from the internet. This is my own proposed architecture of ECNN and ERNN. ECNN stands for Ramchan.
Yes, sir.
I would like to ask you, what is ECNN and what is ERNN?
Uh,
Because if you
Conventional
are strong,
CNN is conventional neural network, RN is recurrent neural network.
convolutional, perfect, perfect. Extension of convolutional neural networks, extended recurrent neural networks. Very good, very good. You remembered very well.
Yes, sir.
So we are taking three types of data sets like text data, chest CT scan, computer tomography scan image data, X-ray data. Then we are applying ERN and ECNN layers with the Keras, TensorFlow, and PyTorch, sklearn, and we are increasing with we are integrating with the frameworks like ResNet 50, VGG16, GoogleNet, etc. Then we are applying the layers like pooling layer. We are combining all the input and hidden and fine tuning parameters in this one. Then we are using activation function called ReLU, and then we are using all the layers, fully connected layer. Finally, we are getting whether that image is viral disease or not. If it is viral disease, what type of viral disease, that we are going to detect. Then steps, you know very well about convolutional neural network. Convolutional, what is the meaning of convolutional, Ramchan?
Uh, Convolutional.
We are combining.
Maybe we have too many, input layers and then
My
hidden
screen is
layers.
visible.
Yes, sir. Yes, sir.
Yeah. Yeah, please read and tell at
It
least.
refers to the combination of two functions to produce a third function.
Correct. Perfect. That means we are combining two or more mathematical functions. Mathematical model is a prime factor for any research, for justification. So we are combining two or more mathematical functions to produce third
Sir,
function.
sir, sir, my battery is
Then,
getting down. Sorry, it may go off.
oh, sorry.